Hello, I am Nurse Amara. Listen closely. The NCLEX will try to scare you with names of diseases you've never heard of, but the symptoms, the cues, are your best friends. The symptoms tell you which ingredient is missing and what action to take. 1. Treat the symptom, not the name. If the test says a patient has Zollinger-Ellison syndrome, a rare condition, and they are vomiting and have low blood pressure, you don't need to know what the syndrome is. The symptom, vomiting plus low BP, equals dehydration divided by shock. The action, give IV fluids. 2. The expected versus unexpected rule. This is how you treat the symptoms to prioritize. If a patient has a broken leg, you expect pain. Pain is a symptom, but it's not a priority. If that same patient is confused and short of breath, that is unexpected. That symptom tells you there is a fat embolus, a killer. That is your priority. NGN scenario. Prioritization by symptom. The case. The nurse is assigned to 4 clients. Which client should the nurse see first? A client with gout, who reports severe pain in the big toe. Expected symptom. A client with pneumonia, who has a cough and a temperature of 101.5 degrees Fahrenheit. Expected symptom. A client with a gastrectomy who is suddenly shaky, sweaty, and confused. Unexpected, acute symptom. A client with chronic renal failure whose last creatinine was 3.0. Expected stable lab. Analysis. Diagnosis #3. You might not remember what a gastrectomy is. The symptom, shaky, sweaty, and confused equals hypoglycemia, dumping syndrome. The action, hypoglycemia is a tiebreaker priority because the brain dies fast without sugar. You treat the symptom of shakiness, confusion first. You will walk into that test and see words you don't recognize. When that happens, don't panic. Look at the symptoms. Are they breathing? Is their heart beating? Are they conscious? You may have taken the NCLEX before, so you know it tries to trick you with big words. This time, look past the big words and look at the cues. If the symptom is unstable, that's your answer. Goodbye for now. Stop trying to know everything and start practicing your symptom logic. I'll see you in our next lesson.